NCSB/NCLEX Practice Exam PDF with answers complete test. Question 1. A nurse is caring for a client who had a cholecystectomy with common bile duct exploration and placement of a T-tube 24 hours ago. The nurse observes large amounts of bilious drainage from the T-tube. Which action should the nurse take? Option A. Administer pain medication. Option B. Clamp the T-tube for 2 hours. Option C. Continue to monitor the drainage. Option D. Lower the head of the bed. The correct answer is option C. Continue to monitor the drainage. 3. Question 2. The nurse is evaluating a client who was admitted for a small bowel obstruction and dehydration. Which observation by the nurse would indicate that the dehydration is improving? Option A. The client has normal active bowel sounds. Option B. The client voided 300 ml of urine in the past 2 hours. Option C. The client denies any nausea or vomiting. Option D. The client reports the passing of flatus. The correct answer is option B. The client voided 300 ml of urine in the past 2 hours. 2. Question 3. A client is admitted to the telemetry unit with syncope due to sinus bradycardia. Which intervention should the nurse include in the client's plan of care? Option A. Maintain the client on bed rest. Option B. Administer a stool softener daily. Option C. Implement seizure precautions. Option D. Discuss the client's wishes for organ donation. The correct answer is option N. Question 4. A client is admitted to the telemetry unit with syncope due to sinus bradycardia. Which intervention should the nurse include in the client's plan of care? Option A. Maintain the client on bed rest. Option B. Administer a stool softener daily. Option C. Implement seizure precautions. Option D. Discuss the client's wishes for organ donation. The correct answer is option B. Administer a stool softener daily. 2. To avoid a vasovagal response, i.e., the slowing of the heart rate caused by bearing down when trying to defecate, and the risk for another syncopal episode, it is important to ensure that the client's bowel movements are soft and easily expelled. The client should also be instructed to avoid holding their breath or bearing down, Valsalva maneuver. Question 5. A client diagnosed with iron deficiency anemia is prescribed ferrous sulfate suspension orally. Which instruction would be most appropriate for the nurse to give to the client regarding this medication? Option A. You should use a straw when taking this medication. Option B. Taking this medication will turn your urine dark orange in color. Option C. Diarrhea is a common side effect when taking this medication. Option D. You should take the medication with food to enhance absorption. The correct answer is option A. You should use a straw when taking this medication. 1. Because liquid iron can stain the teeth, the most appropriate instruction is to use a straw. Question 6. The nurse is caring for a client with a diagnosis of pericarditis. The unlicensed assistive person reports to the nurse that the client's last set of vital signs were blood pressure of 84/40 millimeters Hg, respiratory rate of 28 breaths/minute, heart rate of 112, and the client seemed short of breath. The nurse examines the client and also notes the presence of jugular vein distension. What should the nurse do next? Option A. Administer the prescribed metoprolol. Option B. Notify the healthcare provider. Option C. Place the client on nothing by mouth status. Option D. Obtain a 12-lead electrocardiogram. The correct answer is option B. Notify the healthcare provider. 2. Risk for cardiac tamponade due to jugular vein distension. Question 7. A client is admitted to the cardiology unit for treatment for recurrent supraventricular tachycardia. Which observation by the nurse would best indicate that the client's condition can be considered hemodynamically stable? Option A. The client denies any chest pain and capillary refill is less than 3 seconds. Option B. The client's blood pressure is 88/40 millimeters Hg. Option C. The client's pulse oximeter reads 91% on 3 liters nasal cannula. Option D. The client's cardiac monitor shows a heart rate of 170 beats per minute. The correct answer is option A. The client denies any chest pain and capillary refill is less than 3 seconds. 1. Question 8. A client with a history of chronic alcohol use disorder is admitted to the inpatient unit with a serum magnesium level of 1.0 milliequivalent/L. Which intervention should the nurse implement first? Option A. Assess the client's deep tendon reflexes. Option B. Order the client a meal with foods high in magnesium. Option C. Obtain the client's heart rate and oxygen saturation. Option D. Place the client on fall risk and seizure precautions. The correct answer is option C. Obtain the client's heart rate and oxygen saturation. 3. Question 9. The nurse administered furosemide to a client with acute pulmonary edema. Which observation by the nurse would indicate that the client is experiencing an adverse side effect of the medication? Option A. The client exhibits exertional dyspnea with walking. Option B. The client reports muscle cramps in both legs. Option C. The client's blood pressure is 104/60 mmHg. Option D. The client's weight decreased by 2 pounds in 2 days. The correct answer is option B. The client reports muscle cramps in both legs. 2 muscle cramps and spasms while receiving diuretic therapy could indicate hypokalemia, an adverse drug effect of furosemide because this is a potassium-wasting diuretic. Question 10. The nurse is caring for a client admitted with sickle cell crisis. Which medication is the drug of choice for pain management with this client? Option A. Meperidine. Option B. Ibuprofen. Option C. Acetaminophen. Option D. Hydromorphone. The correct answer is option D. Hydromorphone. 4. Question 11. The nurse is assisting in developing a plan of care for a client who is on complete bed rest due to a spinal cord injury. Which intervention is most important for the nurse to include? Option A. Apply pneumatic compression devices to both legs. Option B. Turn and reposition the client every shift. Option C. Insert an indwelling urinary catheter. Option D. Administer a daily enema. The correct answer is option A. Apply pneumatic compression devices to both legs. 1. Question 12. The nurse is caring for a client with a dry chest tube drainage system due to a left tension pneumothorax. 2 hours ago, the healthcare provider, HCP, changed the chest tube prescription to water seal only. When entering the client's room, the nurse finds the client to be short of breath, tachypneic and with an oxygen saturation, SpO2, of 84%. On auscultation, the nurse notes absent breath sounds to the left upper lobe. What action should the nurse take first? Option A. Apply oxygen via nasal cannula. Option B. Document all interventions in the client's medical record. Option C. Notify the appropriate HCP. Option D. Request a chest X-ray. The correct answer is option A. Apply oxygen via nasal cannula. 1. Question 13. A client has been diagnosed with emphysema. Which intervention should the nurse implement when caring for this client? Option A. Inquire if the client has a power of attorney for healthcare. Option B. Reassure the client that the lung damage is usually reversible. Option C. Schedule a lung cancer screening for the client. Option D. Assist the client with enrolling in a smoking cessation program. The correct answer is option D. Assist the client with enrolling in a smoking cessation program. 4. Question 14. A nurse is administering the influenza vaccine in an occupational health clinic. Within 10 minutes of giving the vaccine to a middle-aged adult male, the man reports having itchy and watery eyes, feeling anxious and short of breath. What should the nurse do first? Option A. Administer SQ epinephrine. Option B. Maintain the airway. Option C. Take the client's vital signs. Option D. Apply oxygen. The correct answer is option A. Administer SQ epinephrine. 1. Question 15. The nurse is evaluating whether teaching a client with dysphagia about preventing aspiration was effective. Which action by the client indicates that additional teaching is required? Option A. The client is sitting in a chair during meals. Option B. The client uses a straw to drink. Option C. The client tucks in the chin while swallowing. Option D. The client alternates solids with liquids. The correct answer is option B. The client uses a straw to drink. 2. Question 16. The nurse is assisting with discharging a client from the hospital who was admitted for acute exacerbation of chronic obstructive pulmonary disease. Which statement by the client indicates that teaching was effective? Option A. I will make sure to get the pneumonia vaccine every October. Option B. I will eat foods low in calories and protein. Option C. I will switch from regular to electronic cigarettes. Option D. I will use my spacer each time I use my inhaler. The correct answer is option D. I will use my spacer each time I use my inhaler. 4. Question 17. The home health nurse is reviewing information with a client who is being treated for pulmonary tuberculosis. Which statement by the nurse is correct? Option A. You should not leave your home until your cough is completely gone. Option B. Your family members should get the tuberculosis vaccine. Option C. You can stop the medications once your symptoms have resolved. Option D. You should avoid public transportation and crowds in enclosed areas. The correct answer is option D. You should avoid public transportation and crowds in enclosed areas. 4.